Hey guys, so we're gonna get started. Thank you for joining us today. This is gonna be the first meeting of the quarter. We're gonna be talking about the application, a little bit of like club logistics, and then we're gonna be talking about a petition, which Emily is gonna present on. And yeah, thank you guys for joining us. If you're a returning member or you're interested in applying, we're excited to have you here.
Okay, so hello guys. I'll be one of your presenters for today. My name is Ruby and I'm a fourth year Phi-Sci major. And
Um,
then we also
my name
have,
is Jenna, I'm a psychobio fourth year major or year.
Hi, I'm Emily, and I'm a fourth year HBS major.
okay, so a little bit more about us. We are a pediatric um, health focused club and we are a student run club and we're dedicated to improving pediatric healthcare. We're involved in many outreach events and community service, such as hospital volunteering through our partnership with Luskin, as well as fundraising events and community service, such as volunteering at our Westside Food Bank. And we have our weekly meetings every Monday at 7 p.m., except weeks 5 and 10. Um, where it's usually we have midterms and finals. We offer you guys a little break because we know you're busy studying. Okay, so we just opened our spring application. So we have the timeline here. Our application opened today and will close on April 3rd. We'll have decisions released by April 5th. And after you get your decision and are accepted into the club, you'll have to pay a 15 club fee, and that's due on April 10th. So the QR code to our application is there. So you'll scan it and feel free to apply. We welcome everyone to apply and hopefully have you guys on our application list so you guys can become a member.
Okay, so then after you guys apply, basically we have a thing called active membership. And to be an active member, you'll just want to get 100 points per quarter and participate in two fundraisers. And I'll go over the point breakdown and then how to get membership or fundraiser credit, like get the two credits for the quarter. So our point breakdown is you'll get 20 points per general meeting. So say for attending this meeting, you'll get 20 points. And then volunteering, you'll get 20 points. So like for example, if you do Luskin, then you'll get 20 points. If you do Westside Food Bank, you'll get 20 points, or just like random sporadic things that we'll have. If you go volunteer somewhere, and we make sure that you were there, then you'll get the 20 points. And then fundraising, I'll go over the fundraising breakdown. But basically, if you volunteer at a fundraising event that we host, then you'll also get 15 points. And then socials, if you attend a social, then you'll get 10 points. So as long as you get 100 points by the end of the quarter, then you're good. So it doesn't really matter what breakdown you do, but you just need to get 100 points by the end of the quarter. And then a benefit to being an active member. Um, so immediately as soon as you're accepted into the club, you'll get 15% off Kaplan MCAT courses and then 20% off all Princeton prep courses. So not just MCAT, but anything that they offer. And then also like access to our volunteering opportunities. And then we're going to be having our board application sometime this quarter. So if you're interested in being on board, you'll get 50% off both Kaplan and Princeton. So just something to keep in mind for later. And then after you're an active member for one quarter, then you'll get access to our test bank. And you can scan that QR code and see like the list of courses that we have materials for. So we have tests and homework and notes and random stuff. And then your second quarter of being an active member, will write a recommendation letter, either by me, Ruby, or Emily. I guess if you have a preference, then you can let us know. But yeah. And then fundraisers. So like it says, if you volunteer, then you'll get 15 points. I know it's like a little bit confusing, but basically, if you participate in any way, then you'll get fundraising credit by either volunteering or donating. And donating could be like buying something on Bruin Walk. So, say we're selling, I think on our poster right there, we're selling Portos. So, if you walk by and you buy something for Portos, then you can just write your name and we'll give you fundraising credit. Or you can donate to our Venmo or GoFundMe. And then if you want the extra 15 points and the fundraising credit, then you can sign up to volunteer on Bruin Walk or wherever we're having our fundraiser event. So that's how you get the 15 points. You don't get the 15 points if you just buy something, but you will get your fundraising credit and you have to participate in two separate fundraisers. So just make sure at some point in the quarter, usually we have like four, um, just participate in two. And we have like a lot of time variation. So like if you have any time within your schedule from like 9 to 3, that's usually when we have our fundraisers.
Okay, so as we've mentioned, we have many volunteering opportunities, one of them being Luskin. So Luskin is a pediatric hospital we're partnered with, and after you apply and are accepted into the club, you'll be able to go to one of their orientations and become a volunteer at the hospital. So that's one of the volunteer opportunities we have and many members enjoy as being part of the club. So this is more of a reminder for current members, but if you are a current member and you're already a Luskin volunteer, please remember to send us a picture of you signing into Luskin to receive your 20 points per quarter.
And then this is a new opportunity that we have with Bryson Sunshine Foundation. And basically, it's going to be virtual tutoring. And you'll be paired with a pediatric, either a cancer patient, like sibling or survivor. And you'll do online tutoring for them by whatever subject you want. And then it'll be like pretty flexible scheduling. And like if you fill out the thing, then we'll send you the interest form and you'll put your general availability and then you'll be matched with either a patient or sibling or whatever. And hopefully with someone who has similar availability to you. And then after you're matched, you'll like set up your meetings and orientations are going to start the week of the 20th. So if you're interested in doing this, then definitely fill out the QR code and we'll send you the scheduling form after.
Okay, so our Westside Food Bank. So during our Westside Food Bank, so members usually will sign up or a week or two prior to the food bank. And this is where members will be able to distribute produce and food items to low-income residents around the neighborhood. So that's a picture of us from our Westside Food Bank from last quarter. And this is just another opportunity for you guys to serve your community and be a help. Okay, and then our Reading to Kids. Um, Current members are able to sign up to a reading club, and the next reading club will be on April 11th. So, to our current volunteers, you can go to their website and RSVP for the next reading club. Volunteers are needed, and for those who wish to sign up to become a volunteer, you'll be able to sign up to volunteer at, I believe there's 3 to 4 options for elementary schools around LA. So if that's something you're interested in, we'll send you an interest form for you to complete and then email you the next steps on how to get involved. Okay, and then we have our mentorship program. So once you become a member, you'll be able to fill out a form and be paired with a mentor. And our mentors help the mentees by giving them academic guidance. And it's also a great opportunity to network and build friendships that will last hopefully outside even for longer than your university career. So that's a great opportunity. And if you want to become a mentor, um, usually those applications are open in the fall time. And that's also a great opportunity for you to build your leadership skills. So that's something to look forward to for next year if you're interested.
And then there's our merch order form. If you're interested in buying merch, um, we'll have this slide at our weeks going forward. I think our pickup form is a little messed. I don't think it's updated. But just message me if you order merch, like I guess like right now, then you can just message me and come pick it up. But if you guys want to order merch, then scan the bigger QR code. We still have a decent amount of sizes left. And yeah, if you want to wait until like later in the quarter, then I think we'll still have merch available. So yeah. And then join our Discord and our newsletter. We send newsletters every week, usually with like our general meeting info and then fundraisers if we have a social, stuff like that. And then Discord if you want like more like up-to-date updates. Like say if we're having a social, but one group's running behind, then you can message in the Discord and like let everyone know. And also just like more like on-time updates. Like if you want a reminder an hour before the general meeting, then join the Discord just to get like more like um real-time updates, I guess. But yeah, you should definitely join both to get both like our updates. And then we'll do Q&A, I think next. So someone already asked if you have a mentor from last quarter, is it the same this quarter? And yes, if you have a mentor from last quarter, then you'll still have the same mentor and mentor group. And if you want to switch mentors, then I think we have a form for that, and it might have been sent in the newsletter. If not, then we can send it after, if you want to switch mentor groups. Um, but yeah, you'll have the same mentor and mentor group. Does anyone else have any other questions? Feel free to unmute or ask it in the chat. And then also you can feel free to email us or DM us on Instagram. Um, and we'll reply to both of those.
So there's another question. It says, if we're already members, do we need to reapply for the quarter again? No. If you are an active member from last quarter, which we will be sending out emails regarding your status from last quarter, and if you receive active membership, you don't have to reapply again for this quarter or pay the membership fee again.
And then someone asked when the application is available, and it's available now. We can resend it in the chat right now. I'm pulling it up. Um, but yeah, it's available now until Friday if you guys missed it. Or not Friday. Wait, yeah, yes, Friday
Yeah.
at midnight.
We've
Um,
also posted it on our Instagram, so you can scan the QR code at your top right, and you'll see that our last post will be our application.
I don't think the application post is up yet, but it should be up to.
Oh, okay. You will find it there tonight.
Um, and then I'm sending the link now. Wait, could you guys go back to the newsletter and Discord slide?
Oh,
There's the newsletter link. Oh, Um,
Okay, so for the Luskin question, they're usually more flexible when it comes to the TB test. So you can get it done after the orientation, but you won't be able to start volunteering until you get the TB test in to them.
is the newsletter thing working for anyone else? It seems to be working on my end, but I'm not sure. And then also where you'll be notified if you received active membership for last quarter. You don't need it'll be our like general email, which was on the last slide. Um and Nancy will probably be sending that either like today or tomorrow or something. Um so you don't need to like send any emails, we'll send it to you.
I can see the newsletter. They
Okay.
were.
Um if the new I can send the form for the newsletter too in the chat if it's not working for anyone or for some people.
If you guys have any other questions, feel free to type it in the chat or you can unmute yourself.
That's the newsletter form if it's not working for some people. And then, yeah, if you guys have any other questions, feel free to DM us or email us. Um, there's no more. Oh, um,
So you don't have to reapply if you're an active member from last quarter, and you don't have to pay the membership fee. There is an attendance form. It'll be at the end of the meeting. Okay. So if you have any other questions, feel free to put in the chat, but I think we'll move on to our petition information.
Okay, hi everyone. I'm going to introduce a petition that we created last year. Our club has grown a lot within this past year, so I wanted to share it once again with all of you. This initiative that we created directly aligns with our mission as a pediatric club to promote health and well-being of children, both now and in our future careers. Many of us are pursuing careers in healthcare with a particular interest in pediatrics. That's why it's so important for us to start thinking now about how we can improve access to care and address the health disparities that many children face every day. So, our petition, we are calling on schools and policymakers to mandate a policy that ensures that all children receive essential care by mandating in school annual physicals and expanding mental health support on campus. The goal is simple, which is to make essential healthcare accessible to every child, regardless of income, insurance, or zip code. We believe that every child deserves basic, essential medical care and mental health support, and schools are one of the most powerful access points to make this happen. So why does this matter? This is directly impacting the physical health of many children. Too many kids are missing basic checkups like things like annual physicals, vaccinations, or developmental screenings. This disproportionately affects low income and minority communities. In fact, low income children are nearly twice as likely to miss annual checkups, according to the National Survey of Children's Health. When children miss these visits, we miss early signs of issues like asthma, diabetes, or developmental delays. This can lead to delayed diagnoses, or more emergency room visits and worsening long-term health outcomes. But this doesn't only affect physical health, but also mental health. We are currently facing a mental health crisis that is especially affecting the youth. In 2021, 42% of high school students reported feeling persistently sad or hopeless. Yet, despite the growing needs, schools are still lacking in necessary resources. The average school has 408 students per counselor, which is far exceeding the recommended 250 to 1 ratio. Students need more support, and schools aren't currently equipped to meet the demand. Mental health issues often begin young, which is why schools are such an important place for early intervention. So now let's talk about the barriers to access. First is cost. Many families, especially those that are low income or undocumented, lack consistent health insurance coverage. Some children may remain uninsured due to eligibility issues, paperwork barriers, or lapses in coverage. Second is transportation. Not every family can get to a clinic, especially in rural or underserved areas. Third is time. Many parents work hourly or multiple jobs, making it difficult to take paid time off. This means that taking the children to a doctor could mean lost wages or risk job stability. These obstacles add up and children's health suffers as a result. The good news is that schools are already playing a key role in healthcare that can be built upon. Many of us probably remember getting vision and hearing tests at schools growing up. These are standard screenings that most public schools provide at specific grade levels, usually as part of the state mandates. The goal is to catch potential issues early before they interfere with a student's ability to learn. In some urban or underserved communities, mobile clinics already visit campuses to provide basic checkups and vaccinations. What we're proposing is to expand on this existing infrastructure, making school-based healthcare more routine, more accessible, and especially more available in these high-need areas where children are often go without care. To ensure healthcare access regardless of insurance or socioeconomic status, we propose two main actions. First is to mandate school-based annual physicals for all students using mobile clinics, similar to how the vision and hearing tests are conducted. Second, we hope to expand funding for counselors, social workers, and telehealth support within schools. This approach prioritizes both physical and mental health because pediatric care must address the whole child. The first step is planning and promotion. We would partner with schools and community organizations like BBPC to coordinate dates, distribute flyers, and send reminders to families. Then mobile health clinics would visit schools, setting up private exam spaces to provide free physicals, vaccines, screenings, and health education. Volunteer teams would play an essential role. They would create families, help guide them through the process, provide translation services when needed, and offer peer-to-peer health education. They would also collect feedback and ensure follow-up care by sending reminders and connecting families to partner clinics or telehealth services. So how does this help? Why school-based health centers matter. Students who use them attend 5.4 more school days per year. This helps improve early detection of health or developmental issues, reduce health disparities in low-income communities, support student academic performance and attendance. So in conclusion, children in our community miss basic physical checkups due to cost, lack of insurance, or parents' work schedules. At the same time, schools are overwhelmed by growing mental health needs, but don't have enough trained staff or support systems. As a club, we should help schools bridge this gap by advocating for in-school physicals and strengthening mental health support. So this is our petition. We would love for you all to sign it and to share it with your friends and family. It is completely free to sign up. And thank you.
Thank you guys. Our goal is to reach 1,000 by the end of the quarter, so please share, please sign with your family, friends. We'd really appreciate all your support. And that is the end of our presentation for today. Thank you guys for joining. We have the QR code on the next slide. And again, if you have any questions, feel free to email us or ask us right now in the chat. Um, yeah, we'll be here for you guys. Feel free to stay behind too if you have any questions. And apply. We'd love to see you guys in spring and in our general meetings this quarter. Tell your friends to apply. Bye, guys.
Bye. Thank you guys for
Bye.
joining.
Thank you. And see you next week in person this time.
We'll be posting the recording on YouTube and we'll probably send it to the Discord. So make sure to join the Discord. Um, maybe go back to the Discord slide.
Yeah,
Oh wait, or is that gonna be too annoying? Oh.
it's fine. We'll get there in a second.
Oh, oh,
Oh.
There you go.
And
there you
then
go.
also if you guys haven't gotten in yet, you could still fill out the uh sign in link and I think you'll still get credit. Um so yeah, we'll post this recording on YouTube and send it to the Discord. And then the application link, we sent it and then it'll also be I'll put the link. But it'll be posted tonight on Instagram. And then it's due this Friday. So this is the application link.
And yes, correct. We haven't yet sent emails regarding your status from last quarter, but we will send those as soon as possible. So expect that by this week for sure.
Thank you guys so much. Have a great day.
Of
Thank
course,
you.
thank you.
You too.
Any questions, feel free to ask.